Hello everyone, my name is Adrian Adams and I am the resident naturopath and nutritionist at Invitation to Health. I have another installment about photobiomodulation or low-level laser therapy. This one is going to concentrate on two particular conditions concerning one area of the body, the thyroid, and we're going to talk about hyperthyroidism or low thyroid hormone output from the thyroid is hyperthyroidism, and then also Hashimoto's thyroiditis, which can swing both ways, so you can kind of get a high thyroid hormone output or it eventually goes to more commonly a low thyroid hormone output, so it causes hyperthyroidism. So these are becoming a lot more common conditions out there in the community, especially with women. So they are a growing concern, and they're something that I've always tried to strive to find effective alternative and progressive therapies for it, and that's what made me stumble across this particular technology or device behind me and applying it to this condition. So to kind of just give you a little bit of an idea, or probably we should start with recapping what photobiomodulation does. Essentially, you've got two forms of light that are coming out of these devices here, and they have therapeutic effects on the body. They will reduce inflammation, they will increase energy output of the cell, they will decrease free radical damage or increase antioxidant mechanisms within the body. They will increase circulation, and they will also reduce pain. So the effects that apply to the thyroid, and we're actually applying the light to the thyroid gland in these particular therapies here. What happens is we're finding that the thyroid responds to this light via obviously improving its overall health. So essentially the cells have more energy to do the work they're meant to be doing. They have less inflammation, so they have a better chance to repair their cells, so in terms of the thyroid. And essentially when you add up all that together, we're getting more thyroid hormone naturally occurring coming out of the thyroid. And there's also a phenomenon where we're noticing systemic or whole body effects of where the thyroid hormone, which is T4 that comes out of the thyroid, is what we nickname it, converting into the more active hormone elsewhere in the body called T3. That is occurring more readily when we're applying light to the thyroid. And that is really important. I'll probably get to that a little later in the video on why that would be. And why it's an issue in these particular conditions. So with hyperthyroidism, you're just noticing that the thyroid hormone level is reduced, and you may be getting symptoms of weight gain, constipation, low mood, or it can go to depression. You also may find kind of like hair issues, cold extremities, and there's a few more symptoms that will come up there as well. So that's hyperthyroidism. When we talk about Hashimoto's thyroiditis, this is more of a condition where we've got the similar symptoms, but it's caused by a specific autoimmune condition, and that's Hashimoto's thyroiditis. So the immune system is damaging the thyroid gland progressively over time. We're unsure of the triggers and things like that, and maybe I'll do another video on kind of the causative factors for that particular condition that we're suspecting. But for this video, we'll concentrate mainly on that the immune system is damaging the tissue within the thyroid gland. And we can measure these by what we call thyroid autoantibodies. And what we're finding in studies when we apply this light is we get a reduction in those autoantibodies. So therefore we're getting a reduction in the immune system damaging the thyroid, and hence the thyroid has more of a chance to repair itself from that damage, and we're getting higher amounts of naturally produced thyroid hormone occurring after this therapy is applied. So that's great. So what this generally equates to in both of these conditions, it's really common for your GP to prescribe T4, which you may know as Utroxic or thyroxine. That is replacing the thyroid hormone that is dropping for these particular conditions, which is really important, and most people feel really, really good from that. But there are some problems with that particular therapy, and sometimes that we're not getting the right conversion of that T4 over to T3. And when we're applying this therapy to the thyroid, we're getting better conversion rates. So the ratio between those two hormones is almost as the normal public or normal populations that don't have these conditions, which is great. And that usually equates to that these symptoms that I listed off before are reducing, and the quality of life of the participants in these studies that I'm drawing this information from improved immensely. So you can think about that in terms of my energy levels are increasing. One thing I did mention, it's very common to get brain fog, so it's like your brain starts working, and you get, hopefully if weight has been impacted, there's other reasons on why you might there might be a weight problem, but they improve. And then you'll get all the other symptoms. Usually it's just caused by thyroid hormone levels being low. They're improving as well. So that's great. The thing that we also find is a lot of people that are prescribed thyroid hormone, they sometimes feel uncomfortable with that because it's really given to them as a lifelong therapy. So what we're finding is that some people, if you catch them early enough, they can actually cease their thyroid medication if they're on very low doses and the conditions haven't progressed very much. That's early stages of those conditions, which is fantastic. Doesn't mean they may not need to have to use that medication in the future, but we can at least delay it, which is great. The other thing is if someone has progressed along those conditions a little bit further, they can at least lower the requirement of their thyroid hormone, and that's been shown in studies to occur quite readily. The other thing that we find is that we get more out of the hormone prescribed to them. So the T4 is prescribed, let's say, at this theoretical level, and more of it's converting over to the T3 that is actually doing most of the work of thyroid hormones. So the thing that's increasing the energy, the thing that's increasing better digestion and less constipation and improving mood, etc. So that one's really exciting as well. The thing that we're finding more in the Hashimoto's thyroiditis, I was talking before about reducing those thyroid autoantibodies, as I said, it's reducing damage in the thyroid. So when researchers are ultrasounding or observing the thyroid via certain scanning techniques, they're noticing that there is less damage occurring in the thyroid, which is great. It means that you've got more of a chance to keep a functioning thyroid gland longer within that particular condition if you suffer from it. So just fantastic results and really exciting for clinicians like myself and also the patients that I'm able to use it with. The kind of logistics of what is the protocol and things like that. Essentially, we're looking at, it ranges from like 3 days intense kind of sessions, or what I tend to do, which is a little bit more manageable for my patients, is we'll do 2 sessions over 4 weeks. Those sessions, initial appointments will be 30 minutes, and then follow-up appointments will be 15 minutes. You'll get essentially, like I said, 2 treatments per week for 4 weeks there. The pricing for those, essentially we have $85 for your initial. That allows me to kind of develop your protocol, adjust it to you personally, and then to write all my notes in there, and your laser therapy is applied in the same appointment. And then from subsequent appointments are only 15 minutes, and they're $65 for those. Probably the biggest bonus I'll let you know about that particular protocol is doesn't need to be an ongoing therapy. What we found on average when we study or when we look through all the studies of this type of device applied to the thyroid in these particular conditions is the average positive effect lasts 11 months. So that's quite unusual for a lot of therapies. Usually you have to just keep doing them all the time. In this instance, we found that we apply the protocol, the improvements are long lasting. And what we're looking at is kind of repeating this protocol for the individuals that are enrolled and getting this treatment probably on a yearly basis to maintain that effect, which is fantastic. That's pretty manageable for most of us to manage each year. So great, and you can imagine that's quite a cost-effective therapy too. The things that you'll need to do before you enroll in getting this, if this interests you, is essentially you'll need to have all of your relative scans and ultrasounds done on the thyroid. So please consult with your GPs to make sure you have all of those, just so that we know what the thyroid is doing prior to therapy. You'll have all of your blood hormone levels tested. And then we'll also be doing follow-up scans. If you're already a patient here at IT or Invitation to Health, that's really easy. I'll team up and consult with your GP that is on staff here and make sure that's all done before you start it. But go through your GP, consult through them and go, I'm interested in this program Adrian's spoken about. Or you can email me directly at aadams@invitationtohealth.com.au to find out more information via me, and I can coordinate that for you if you want. If you're not a patient here already, email that email address that I just quoted, then I'll give you some details on how you can go about making sure you have all the relative scans there, and we'll just go through the GP that you currently have, or you always have the option to see one of the GPs here. So if you have any further questions and I haven't gone over it in this video, please use that contact email address there, or you can give the clinic a call. And yeah, I hope you enjoy that information, and I hope it excites you just as much as it excites me on being able to help people that are suffering with hypothyroidism and Hashimoto's thyroiditis. Thank you.